Hello, everybody. Welcome to our medical talk today with Professor Cesnulis, neurosurgeon from Hirslanden Clinic in Zurich. Thank you, Professor, for taking the time. Today, our topic is brain cancer, brain tumors, and I want to jump right in with my first questions, and that would be, what are the first signs of a brain cancer?
Well, hello, Peter. The first signs of a brain tumor, let me say, because the tumors are very different. It's not necessarily cancer type of tumors. There are also a lot of benign tumors of the brain. There are generally two types of the symptoms, because first of all, you should understand, here I have a model of our head and the skull. Our skull cavity is closed environment. Okay, it is closed bony cavity, which is filled by the brain vessels, cerebrospinal fluid, and so on and so on. And every space occupying lesion, okay, like tumor, bleeding, some inflammatory mass, and so on and so on, it causes compression on the neighboring structures of the brain, and also it causes overall general compression inside the skull cavity. Okay, so if we have a large brain tumor, so first of all, we can have so-called general symptoms of elevated intracranial pressure, which may look like headaches, some nausea, vomiting, some diminution of consciousness, and so on and so on. So this is the first group of the symptoms, the so-called general symptoms. Mm-hmm. Secondly, there are specific symptoms, and as you see, the brain is quite large, and there are a lot of areas in the brain which have no functions or less neurological functions, and there are so-called highly eloquated area in the brain, and the symptoms depends very much on the place where the tumor starts to grow. Mm-hmm. And these symptoms are divided into irritative and into suppressive symptoms. So irritative symptoms could be an epileptic seizure, because if we have a tumor which is not far away from in so-called epileptogenic areas of the brain, so the people may have a first symptoms which is some kind of epileptic seizure. That's why it is important, if somebody has epileptic seizure for first time in their life, it is necessary to perform the MRI scan to exclude some space occupying lesion. Okay, and only after this, when MRI is clean, you can go just for the treatment of various kinds of epilepsy. And the second group of its symptoms, they depend very much on where the tumor grows. So it can be started like with some paralysis of the arm, of the leg. It can start with some loss of visual fields. It can start with visual diminution or loss of a hearing on one ear, or some eye moving disorders if we have pituitary glands. So it can be some hormonal changes in the body, and so on and so on. So it depends very much on the place where the tumor starts to grow.
Okay. Now, let's say in the unfortunate case that a brain tumor is discovered, yeah. We would like to be interested to understand a little bit more how a surgery in, let's say, this delicate environment is actually done. Can you maybe give us some insight of your daily work, basically?
Well, the surgery is, as you exactly said, is very delicate, but nowadays we do not operate in conditions which was 100 years ago. We perform the surgery using cutting-edge technologies, using neurosurgical microscopes with big magnification. We have specially developed instruments for very delicate work. We use navigation systems in order to have a navigation during the surgery and to minimize the approach.
May I just ask, because I have heard that already. Like, are we talking some kind of brain GPS, or how can I imagine?
It's very similar like a GPS in the car. It's very similar because our instrument is like a car, okay, and the brain is like our road, okay, and we have an MRI scan, a special MRI scan, which we upload into the navigation system, and then we have a special infrared camera, and we have a special mounted device on the head on the patient, which is fixed during the surgery, and then we have to match our instruments, okay, and this camera can show us on the MRI where we are. So we see on that MRI scan where the tips of our instruments are. So we can plan, we can build up some virtual or augmented reality, what will happen, and so on and so on. So it gives much more safety for this kind of surgery. Then we apply also some methods like intraoperative neuromonitoring. So we have a special doctor in our operating unit which monitors the neurological functions of the patients which is under anesthesia. So we operate and we can know how far away are we from this very highly evacuated areas. We can monitor, let me say, the motor function of the patient. We can monitor even the vision of the patient which is under general anesthesia. Okay, so then we have special approaches to identify the borders of the tumor in the infiltrative cases. So we have a special substances which are given to the patient just before the surgery, and then we have a special filters on our microscope which shows, let me say, the healthy brain in a dark blue, and the tumor is on a pink color, and the borders are also pink blue. So we can perform much more radical and safe resection with these technologies.
Oh, this is crazy. Thank you for sharing, Professor. This is really, I think, I mean, for you, obviously, it's an everyday work, but let's say for people outside of the brain surgery world, it's at least to me, it's like super fascinating what we can achieve with a combination of technologies and surgical know-how. Obviously, I mean, not just I assume a good navigation system, it also needs a professional and well-trained surgeon to do this, right?
Yeah, absolutely. So it's not a one-man show. It is a teamwork. Of course, we have one surgeon who leads a team, who leads the surgery, but there is a team of doctors and the nurses, which are on the surgery involved.
Okay, Professor. I don't want these interviews to be too long because the attention span usually is between 8 to 10 minutes. Yeah. So thank you very much for helping us,
thank you, Peter,
understand how you work and sharing all these insights. Thank you very much.
Thank you.